A pleasant good afternoon to one and all. We welcome you this afternoon to this interactive session. On behalf of Jennings Ebenezer Connection JEC, I'd like to welcome you to this live question and answer session on COVID-19 vaccine frequently asked questions. I am Lorraine Josiah, the Secretary and Public Relations Officer of JEC. This afternoon session will be very interactive, and as such, it will be facilitated by two very competent physicians. Please allow me to introduce you to our first physician, Dr. Kwame Francis, MD, who is a Wayne State University School of Medicine trained family physician. Dr. Francis is currently an attending physician at the Ascension St. John Hospital in Detroit, Michigan, where he practices comprehensive primary care, outpatient and inpatient medicine, and also obstetrics for adults and children. Additionally, Dr. Francis oversees resident clinical competency and trains students and residents. Our second physician is the University of Alabama School of Medicine trained Dr. Darryl Prime, MD, MS, FAAC. Dr. Prime is also an attending physician at the Gadsden, Alabama Regional Medical Center, located in Gadsden, Alabama, where he practices interventional cardiology. You have met our physicians. Now it's time to start the show. Remember, you can submit your questions during the broadcast via the comment section. Once again, thank you for joining us, and please share the live with your family and friends. Enjoy the session. Thank you.
Excellent. Thank you, Lorraine. And so, in our JC custom, as a resident pastor in JC, I want to open up with a word of prayer. And so let's pray. Heavenly Father, we thank you for this opportunity. Father, we thank you for the community of Jennings and Ebenezer and the people, oh God. And Father, for all those who are watching, oh God, we thank you for the leadership of this organization, oh God. We speak your blessings over Mr. Alexis Martin, oh God, or President. We speak that you'll bless and you'll strengthen him, oh God. And Father, for every person who are tuned in, oh God, we pray that you'll bless them. We know that these past year and a half has been a challenging time for so many people with illness and loss of jobs and loss of income and just the stress of this time. We pray for government officials, oh God, that you'll give them wisdom and guidance how to govern your people, oh God, because ultimately all people are your people. And Father, we bless and thank you in Jesus' name. Amen. Amen. Well, thank you, Lorraine, for that introduction. Like she says, I'm Kwame Francis, and just want to give a brief overview in terms of what we plan to do here. So, the goal, here is to provide you with information regarding the COVID-19 vaccine and to answer your question. So, Darryl and I have no stock in AstraZeneca or any of the other vaccine companies. And so we just simply want to be a support and be a blessing to our community to answer your questions and to be there for you. There would be really no need to do a presentation like this unless there was widespread distrust of government and institutions as a whole. Our people, as I'll say, especially Black people over the years, from colonial times where we were taken as slaves from our home country and mistreated all the way up to today. Black people have a lot of reason to mistrust government, to mistrust formal institutions. And so, the mistrust and some of the concerns are definitely warranted. So we want to take some time, to respect your questions and your comments and to provide unbiased feedback. And hopefully, as we get into the conversation a little bit later, also to help to provide some personal testimonials regarding our road, regarding seeing people getting sick from COVID-19 and our interactions with the vaccines that are out there. Just by way of introduction as well, just to explain a little bit in terms of how vaccines work. So first of all, the viruses attack our body, and our bodies have God-given immune systems. And so for most of us, we get sick, our immune systems kick in, and we get better. And if that same virus attacks our body again, we have memory cells that actually remember that infection, and they fight it off, even the quicker and and more effective. So the idea behind vaccines is to trick your body to think that it's actually getting the illness by giving you this vaccine. Your body produce what's called antibodies and memory cells that remember that infection. That if you should run into COVID-19, if it's a COVID-19 vaccine or any other virus, if you should run into what you were vaccinated against, your body is already prepared for it. I like to use the analogy. And I have a presentation I did on YouTube if individuals would like to watch it, on and actually how vaccines work. And if you'd like to take a look at it, but the analogy that I use is, imagine your country, whatever country that is getting invaded by an external army. Do you want to be training soldiers at that time, or do you want to already have trained soldiers ready to fight? And the obvious answer for most of us is we want to already have trained soldiers to defend our land. And that's pretty much what vaccines are. Vaccines, they already train your immune system to face and to fight the incoming threat and the incoming attack, so that you're not getting sick and you're not in the hospital. So the vaccines, they don't prevent you from getting the virus. They just prime your body that if you do get the virus, you are ready and you're in a state to avoid getting severely ill, to avoid going to the hospital and being on a ventilator, to avoid dying from the virus. And the efficacy of most of these vaccines are actually very, very good when compared to other vaccines. And so with that, I'll stop and I'll turn it over to Dr. Prime, and I'll let him give his introduction as well.
Yes, I echo the remarks of Kwame regarding our reservations on taking vaccines. So, you know, technically, in order to mount an immune response, that is your body to fight off infection, you have to introduce a portion or a crippled form or a piece of the actual, you know, virus or bacteria, etc., to your body, so that your body, once recognizing it, can prepare to fight if the real thing comes. So, that's unfortunately where a lot of the suspicion comes in. Now, what are you actually injecting in me? So, and everybody has that. Whether white, black, Chinese, or whatever, everybody's gonna have reservations on that. Because you're putting your trust in the government and in the medical community to do the right thing for you. And even if they are as honest and sincere and hardworking as possible, we are human. And so even if we try our best to make sure this thing is as risk-free as possible, there's still a chance something happens wrong. This just the nature of the world we live in. And so like Kwame and I spoke earlier, our business here today is to try to educate you as much as possible regarding this whole business, so that you can best make decisions for you and your family. That's where that's why we're here today.
Excellent. Thank you, Darryl. And so we had some questions that were submitted to us online ahead of time. And so what I want to do, I want to go ahead and answer those questions. Also, when we're done with these questions, we're going to give individuals who are live an opportunity to ask questions. And so while we're talking, if you want to go ahead and post questions in the chat, this is your opportunity to post some questions. So the first question that was submitted by an individual is, how were they able to create the vaccines in such a short time? Let me repeat that question. How were they able to create the vaccine in such a short time? And that is an excellent question. It's a question that I have, question that I ask as well. It's a question that many people ask. So whoever asked this question, you're in the vein of something really, really good there. And the response to that, first of all, is vaccines generally take an average about 10 years, to create. And these vaccines were made in months, whether the Pfizer, Johnson & Johnson, AstraZeneca, they were created in the order of months. And so 10 years versus several months, that should be a question that individuals ask. The response to that is one, where first of all, we're in a pandemic. Most vaccines are not made in a pandemic. So you don't have this sense of urgency, right? So the pandemic created a sense of urgency and global collaboration. And so the collaboration that was there and the resources that was put behind it. When you have a private company, whether AstraZeneca or Pfizer, whoever else, Johnson and Johnson trying to make a vaccine, trying to make a vaccine for profit. And so they do one step. If that step works, they go to the next step. And they don't want to invest in all the steps right at one time. And so what happened with the creation of this current vaccine is that governments and institutions put a lot of money into getting us out of this global pandemic. And so the companies had incentive to go ahead and do all the steps at one time. So they didn't really skip steps, so they had preclinical trials, they had phase 1, phase 2 trials, all the things that you would do in vaccine production. All those things were actually done rather than staggering them and do one thing after another. What actually happened, they overlapped a whole lot of those things because there was an incentive to get us out of this global shutdown. So that's why. So the resources were there, and the unity of the community. Another thing is that some of the technology, for these vaccines was already created before COVID-19 came about. So some of the technology already existed, and people were already working on things like this. So in years past, we saw the SARS infection, and we also saw MERS, and those are COVID viruses as well, similar to the COVID-19 virus. So we had some experience with working on vaccination. So though it seemed like it was really warp speed, there was some experience that was there before. Darryl, I don't know if you want to add to that as
Yeah.
well.
Yeah, I mean, just to kind of over expand. So you know, the virus has um, common elements to the common cold and common elements to other associated, epidemics like the Middle Eastern, respiratory severe infection virus and SARS virus. So they knew then the common elements of the coronavirus. So the one of the main common element is the crown of the virus. So this is why they call it corona. That's another word for crown. So the little spikes on the top is common to all that whole family of coronavirus. So spikes on the top, once they get into your lungs like a football, they'll slow down and they'll attach to a receptor. That common receptor, that common component is what is basically the target for vaccine development. So that common part, even though these are different, they have different virulence, they have different strains, they have totally different ways of presenting infection. That common element is the key and one of the major factors in why the vaccine was developed rather quickly, because they knew about that common element for decades.
Thank you, Darryl. So next question is, should I take the vaccine if I have food allergies? Should I take the vaccine if I had food allergies? And so so people who are allergic to certain foods, for example, have Darryl, if you want to take a shot at this one first.
That's a good question. So I'm a lowly cardiologist, so I don't know a lot about, basic medicine anymore. At one point I did, but the a lot of the if I'm not mistaken, there's no interaction with any kind of major foods. Some of the carriers for vaccines like influenza are things like eggs and egg yolks, and so if there is some common allergy there, then you would not want to mess with that. But in this case, the vectors don't interact with any particular foods that people are commonly allergic to. So.
And that's definitely correct. So one, it depends on the type of food you're allergic to. because everything don't really cross react. And so like some vaccines are grown in eggs, and so people who have egg allergies can't take those. That is not the case with these vaccines. And so, one, you should definitely talk to your doctor if you have allergies to things that we don't know specifically. And so for the individual that asked that question, we don't know your specific um, allergies, and so you should definitely look into that closer with your personal physician. But in general, we haven't seen any issues. We vaccinated people at my clinic with, who have vaccines, who have allergies. And for all the vaccinations, one of the things that we do, we watch people for about 15 minutes to make sure that they don't develop any immediate side effects. All right. So shouldn't be any issues if you have food allergies, but you should definitely talk to your doctor as well. Let's see. What are the long-term side effects of this vaccine? And so I'm going to talk a little bit about some of the common short-term side effects. So the question again is, what are the long-term side effects? Um, the common side effects that are short-term can be nausea, fever, chills, muscle pain, headache, swelling, and tiredness. Those are some of the common side effects. And the fact that you developed a side effect shouldn't doesn't mean that you shouldn't take it. If any of these things actually develop, it's actually a sign that the vaccine is actually working for you. So if you develop these things, it's a sign. These are short-lived; they're not long-term issues, and it's a sign that your immune system is actually revving up and starting to work. Long-term, the honestly, the vaccines have just been around for several months, and so no one has any long-term data in terms of what will happen down the line. So there's no information about that. Darryl?
Yeah, same thing here. I mean, if you think about the timeline, this thing has been with us for, a year and a some. So we really don't know what the long-term effects are. We do know that COVID-19 is no joke.
Yeah,
This thing um, is unbelievably infective, and it's exponential when it does so. So the numbers go quickly in this kind of a anyway where quickly a whole population can get infected.
yeah,
Not only that, it replicates in the order of millions in your body, and every replication there's a potential for an advantageous mutation for the virus, where you can develop all kinds of different strains that can give you different types of disease processes and syndromes. So it's just this virus is no joke. This virus is absolutely no joke.
yeah. All right.
Um,
I'm sorry, go ahead.
no, I was saying, even how, just to give you an idea of how dangerous this virus is. If even if we suppress it completely, if there's still five or six virulence in of small amounts in the community, it could just blossom all over again. And that's that's how much of a problem this thing is.
Yeah,
Yeah.
yeah.
So we have some questions coming in, it looks like.
Let's see. Let's take some of the live questions. What happened if you, so one of the question is, what happened if you did not have any reactions to the vaccine? So if you had none of the things that I mentioned, no headaches, no nausea, none of those things, I get the idea is it not effective to you then? And the answer to that is it is still effective. You just didn't experience any of the side effects. All right. So it is definitely still effective. And I think that was a question by Lorraine. So if you had absolutely no side effects, the vaccine is still effective. We have another question here by Dequan Francis, and it says, "Why can't children take the vaccine?" And that's another good question. And Darryl, you want to take a stab at that one first?
Um, again, I basically listen. I mean, just after listening to your lecture, basically is what I'm going to say here. So the vaccine has not been tested in children, so they really don't know the efficacy. I suspect that it'll have similar efficacy But you know what you're trying to do is mount an immune response. And one important concept is when you're trying to elicit an immune response, and there's inflammation going on, and your body is fighting a particular protein associated with the virus. Sometimes things can get haywire, right? Things can get where the inflammatory response is too strong, and then you have more problems with the immune response rather than as a result of the vaccine itself. So a lot of the manufacturers are wary of vaccinating children because of that, or proposing that initially. So yes, we do. We really don't. That's why the children are not getting the vaccine right now.
Yeah. And also in addition to what Darryl said is, there haven't been a lot of studies on children, and so those studies are actually going on now. They're actually testing children to see what will happen with the vaccine. So a large part of why they haven't done the vaccine in children is that just because they haven't really tested it yet. And so right now those testings are going on, and I believe pretty soon they're going to start with ages 12 and up, in the near
12 to
future.
18.
12, yeah, 12 to 18, in the near future. We have a question by Elvis Weaver. It says, I know everyone have a choice. However, I'm concerned that a few of the officers in the fire department has refused to take the vaccine without a good reason. How can I encourage them that it is important to take the vaccine? That is an important point. I think the first point you made is important. Everyone is free to make their own decision. The interesting thing with things that you can communicate with others, or you can transmit to others, like viruses, each person's decision actually impact the other person. So if I'm vaccinated, and for example someone in my household isn't, you know we impact one another. So that has been a source of contention. There are people in the healthcare field, some are vaccinated, some are not. um, and that's been a source of contention. The thing that I'll say, Elvis, is if you can talk to those individuals, if you have a relationship with them, ask them why. Sometimes the why would go a long way. If it's something where they just think, well, it's something by the government that they're using to sterilize us or to keep down people or stuff like that. You can address some of those issues. But it's really important to ask why. And then you can respond to the specific, because every person who don't want to get the vaccine is for a different reason.
Yeah.
Some people, so you got to ask them. Some people have a really good reason not to get the vaccine. Some people have cancer. Some people are undergoing chemo. Some people have a poor immune system where they actually cannot get vaccinated. And so there's some good reasons why some people can't get it. So if you ask people why you don't get the vaccine, and actually have a healthy discussion, I think that'd be important.
Yeah. I think the more we communicate as a community, in microcosm and as a whole, particularly as Black folks, not just in Jennings, not just in Antigua, not just in the U.S., but throughout the whole world, the better things will be for us as in general. And we have to keep the communication lines open as much as possible. And so it's good to try to have them open up and just start the discussion.
Yeah, that's true. This in anything that we differ on, whether it's religion or politics or whatever it might be, if we have a discussion with one another, we'll find that we're not so alien from one another, and which is why we're having the conversation now. And having respectful conversation with people who differ from you is really important to have. We have another question on Facebook from Michael Joseph. It says, what
Yeah.
happens to people who take the first dose of the vaccine and refuse to take the second dose? What happens
It's a
to
good
people who
question.
take the first dose and refuse to take the second dose? Um, I'll say that they actually did studies, with all the vaccines. They tried one dose, they tried different intervals, they tried decreased dose, and they got varying results with different things. Actually, now the AstraZeneca in Europe, they're actually trying to space the doses so that everyone, more people can get the first dose. Um, so one dose is better than no dose. Is the first thing that I'll say. So if you take the first dose and not the second, you do have some immunity. It might not be as well as if you don't get any of the vaccine, but one dose is better than no dose. But you know that you don't have the full immunity, because we've seen cases where people take one dose and before they could go and get the second dose, they got infected with COVID-19. We've there's been a lot of cases of that. So you do have some protection, but not the full protection as you would have um, if you'd have taken both doses. Which also leads to another question that somebody else asked in the questions that they submit, is that how long, after you got both doses, do you have immunity? How long do you have immunity? How long does it take to develop full immunity? The answer to that question is it takes about 2 weeks. So it's not like you get your second shot today and you're good and you're good to go. You actually,
Right.
it takes about 2 weeks before you develop, your full immunity. So you could get the two shots, and the next day you could have an unfortunate event where you run into COVID. So you still do, if you get vaccinated, it's really important. We can't overstate enough that you still really do need to be cautious. You still need to follow the guidelines and social distancing and masking and sanitizing, washing your hands and things like that. Even the vaccine is not a free pass just to be careless. Uh, and Darryl, I'll let you jump in here.
Oh no, I agree. Yeah.
Let's see. The next question is, can I take the vaccine if I've been diagnosed with COVID-19? Can I take the vaccine if I've been diagnosed with COVID-19? And the answer to that is yes. They actually did studies on this. What tends to happen is the vaccine, with you already have well, let me answer. Let me say this part first. If you are newly diagnosed with COVID-19, you shouldn't go to a vaccine center to get the vaccine. You should be quarantining until your symptoms are gone, until it's safe for you to come out of quarantine. So if you have an active infection of COVID-19, you should not get vaccinated. Let me say that first. So if you have an active infection of COVID-19, you should not go to get vaccinated. So you should wait, till your symptoms are gone, and anywhere from 30 to 90 days. You should wait about 30 to 90 days, before, because the getting the infection itself gives you some immunity. And then there's some studies that actually looked at people who got the infection and got the vaccine. It almost like, I don't want to say a double boost, but they had an extra boost of their immunity. So they're probably more protected than the rest of us, because they had the natural infection itself and they actually had the virus. So they're well protected. They're probably the most protected in the community.
Right.
So yes, you can get it.
Right. Yeah, I had COVID-19 infection with pneumonia in late November. Um, I probably got it from the hospital, and I was deathly ill. So the first 10 days, I felt great. I was like, man, this thing, I could beat this. And then on the 11th day, I passed out completely, just passed out in
Wow.
the the back of the car. My wife rushed me to the hospital. I get a CT scan to make sure I didn't have any blood clots, and I had pneumonia in the bottom of my lungs. And took me 5 weeks to get over it. I was so weak, I couldn't even walk 10 steps without being short of breath. Or having to literally to crawl on all fours.
Wow.
Absolutely, absolutely the sickest I've ever been. It's hard to describe the infection because 1 minute you're fine, and literally in 10 seconds you cannot move your limbs.
Wow.
And it's a degree of illness that that quick is what's so scary about it. You literally don't have any time
Hmm.
to get clear when it hit you because it's so fast. And so I was so terrified of getting it again. 30 days later, I took the vaccine. Um, and I had fever, I had chest pain, shortness of breath for about 24 hours. In the second dose, I didn't have any symptoms, but I probably took it too soon. And they suggest taking it 90 days because you already have antibodies. That is, your body's ready to go if it were to get hit again. And so when I took the vaccine, it just hit, my immune system just hit me again. So, but 90 days is what's suggested. You know.
Yeah. Yeah, that is a interesting experience, and I'm glad you're okay, Darryl. Because I'm sure that
Yeah.
was that was scary.
Oh yeah,
You
that's
know,
unbelievable. It's
yeah,
hard to describe it. It's
yeah,
really hard to describe
yeah.
COVID-19 infection.
You know, well, since you mentioned, let's switch gears a little bit. Now we're answering these questions, but let's talk
Hmm.
about some of the impact that we've seen in our hospitals and in our community. That you want to share what's going on with your hospital and your community, like at the height of COVID. What's been happening and what you've been seeing?
Oh, with COVID, so where I'm at, the worst part was Thanksgiving and Christmas, because people in the southern United States, they don't want to give up the Thanksgiving and Christmas, and so everybody got it. It was truly unbelievable, literally. And so we had 10 ambulances lined up. We had, out in the ERB, we had 20 people in the lobby waiting to get into the ER. We had 70 people in the hospital. We had the ICUs, which was like 15, actually 30 ICU beds completely filled with COVID people on the ventilator. And that's the biggest problem with COVID. When it starts to get that way, you outstrip the resources of the medical community. And when you outstrip when you literally cannot get a bed to get taken care of, that's when people start dying like crazy. So it's really a community effort to try to suppress it. It's really a community. And regarding this next question here, what happens if one person out of a household of five takes the vaccine? So that's a good question. What do you think, Kwame?
Yeah, I was that person. They work almost like a firewall for the rest. I mean, statistically, that's it's they're in the minority, so they're protected from it, but other people in the household can still get
That's
it
right.
because they're
That's
they're
right.
in they're in the minority in the household. So
That's
I
right.
mean, it works
So
best if most people in the household get
right,
it, because that one person is really still in the minority. Again, one is
right.
better than none, but
Yeah.
there's still a significant risk for the rest of the person. Now, that one person who's vaccinated, if they do get COVID, their symptoms would be much milder,
Yeah.
than if they didn't. But the others, because the four others are definitely still at risk.
That's good. And using the terminology that Kwame uses, he says about he mentions a firewall, and that's essentially what it is. For example, if you had four people out of that household vaccinated and one was not, they act like a barrier, okay, for that fifth person from getting the infection. So that's the where the term herd immunity comes in, where there are these series of firewalls in the community where, if everybody's not infected, but upwards of 75% or 80%, but now they're saying with COVID specifically, you might need higher numbers than that. Then you're able to extinguish the infection in the community, even if not 100% of people are vaccinated. So
Yeah, and as a good scenario for if you let's say you have an 85-year-old grandmother or grandfather in the house who have a poor immune system and who's really sick, who really shouldn't get the vaccine or in a position where they can't get the vaccine. If that 85-year-old person lives in a house with four other younger people, those four other younger people get the vaccine, they act as a firewall and as a protection for that one person who can't get the vaccine. So that'd be an example where that would work in your favor, where you would actually protect somebody, who can't get the vaccine. Because like I said, there are people for various reasons, so, who cannot get the vaccine.
That's a very important question here from yeah, is it Francisca August? Or I don't know how you pronounce the last name. Why should I take a vaccine that can't protect from COVID?
Yeah, that's a really important question. The way I would answer it, I would first of all look at the impacts of COVID itself. So we talked a little bit about, and we'll talk a little bit more as well, what COVID actually does, right? It's, and I would say it's like wearing a bulletproof vest. If you ever watch a
Yeah,
movie and you see somebody, get shot when they're wearing a bulletproof vest, it actually still hurt. Those people, when they get shot with a bulletproof vest, they still go down. But the key is
right,
they don't die. And so when you
right,
talk about the efficacy of the COVID vaccine, none of it says that it stops you from getting COVID. It stops you from going to the hospital and getting severely ill, and it stops you from dying from COVID-19.
right. And
Which
that's
go ahead, Darryl.
no, no, go ahead. That's the important thing. So not only that, you get the benefit of the antibodies, right? So let's say you didn't take the vaccine, but you got mild COVID infection. That is a good scenario as well, at least
Yeah,
for 3 months, because you have the antibodies that protect you from a severe one. Don't forget, you can get this thing two, three times. I have patients who have gotten it two times. Many patients have got so. This is how bad this infection is. In so many ways, it can try to come back to get you. So, um, you know, the key is if it's at least you get it because I guess if it gets into the community in high numbers, it's so rampant that almost everybody is going to be exposed to it. And so
yeah,
even if you get a mild form of it, that's the best scenario because um
yeah.
it's the other scenarios, believe me, are just horrible. Um Absolutely horrible. I've had six of my close friends, most of them in the medical community, die from this, and
Wow.
it's been absolutely devastating. So cardiologists, nurse practitioners, nurses, you know, it's been
Yeah.
really bad.
Yeah, it's been bad. I remember walking down initially in last year around this time, just walking down the halls of the hospital, and their gowns on the door, people dressed in their PPE, and there was such a dark cloud over the hospital at that time that people don't make eye contact. They're not saying
Yeah,
hello because everybody's just, it's like gloom and doom. It's almost like you can feel death in the hospital. And
yeah,
in those times when the numbers are that high, one of the
yeah.
things that you actually have is that family and friends can't visit. So we actually have patients who are dying in the hospital. Right? We have
Hmm.
patients who are dying in the hospital alone.
Yeah,
Where family and friends can't see them. I remember some days I have to dress in my PP, and I would hold up a phone or a tablet or something and put it on video so that this person can see their loved ones and communicate with them. And sometimes that's the
yeah,
last communication that
yeah.
they
They
have
have.
with their loved ones. It's like the suffering of it is just, and unless you be in the thick of it, is just so difficult.
Definitely.
You know,
It's the
and
worst disease ever. It's horrible.
yeah, and it's a respiratory virus. But if you think about what happens to with COVID, right, it literally shuts down your system. You can get blood clots, and people have strokes with COVID. People have long term breathing issues. I mean, it's just a lot of things that happen, and not the least of which we haven't even talked about the economic impact. Yet. So think about a nation like Antigua and Barbuda with tourism when everything shut down. If
Yeah,
tourism is a significant percent of the GDP, then there goes your economy.
yeah.
If no one is traveling. So that leads to another question. It says, is it true that the vaccine can actually cause blood clots? Is it true that the vaccine can actually cause blood clots? And right now, so um, the Johnson and Johnson vaccine and the AstraZeneca vaccines, which are viral vector vaccines, they actually put the genetic code for that spike protein, that crown on top of the virus that Darryl was talking about. They put the genetic code for that protein, in a virus that can't make people sick, and that's what the vaccine is. And that and your body produces an immune response to that spike protein. So one again, that genetic code, it can't interact with your genetic code, and it doesn't allow for viral replication. It just allows you to boost an immune response. And with those two vaccines specifically, Johnson and Johnson, because they're viral vector vaccines, Johnson and Johnson, the AstraZeneca, which is the one in Antigua, they have been reported cases of blood clots. And I'll say here in the U.S., Johnson and Johnson, there've been about 7 million doses of the Johnson and Johnson vaccine, and out of that 7 million, I would say about 6 people out of 7 million have gotten these blood clots, and so that's less than 0.0001%. And the demographics of those people are white women less than age 50.
Yeah.
Right? And out of that six, one person died. Yes, so they have been reported cases of blood clots. But I'll also say that there have been reported cases of blood clots with just getting COVID, COVID itself. Right? And so right now, no, in the Johnson and Johnson vaccine in the U.S., it's been paused as they review what to do with these rare blood clots, because people don't quite know what to make of it and what to actually do. So they're coming up with guidance to actually give the medical community before they start doing it again. But again, it's really rare. And again, when you think about those numbers, right? So, and the AstraZeneca, I think it's something like 70 out of, I think, 3 million, or somewhere between 3 and 4 million in the UK who
Yeah,
had
I think
who
19 died, I think.
yeah, who had the blood clots, right? So when you look at those numbers, right, 3 million, and you look at the population of Antigua and Barbuda, which is a little bit under 100,000 people. So statistically, it is very unlikely that any person in Antigua that will happen to. Just looking at numbers, right? Because if it happens in 1 in 7 million, we only have 100,000 people between the two islands, less than 100,000 people. So statistically, for that to happen, the chance is not zero, but the chance is very close to zero.
Yeah. Here's another question, Angie Henry. If you have really bad side effects after the first dose, would it be advisable to take the second dose? That's a good question. I had one patient who had a really bad effect with it. She's an older lady, and she developed acute heart failure with the first dose. It's coincidental. There's a chance that it may not have been the vaccine, but I opted not to have her undergo the second dose because that's a recommendation by the CDC if you have a really bad side effect. Now, side effect requiring hospitalization. Not talking about a little sore arm or even low grade fever. I had after my first vaccination, I had fever, you name it. That if you have stuff like that, it's basically your body telling you, hey, look, I'm fighting this off, and I'm basically building my little army to fight off infection. So by all means, you take the second one in that instance, right, Kwame?
Yeah, and I'll say I got my first dose actually before the end of the year, sometime in December, and I had soreness in my arm for 2 days, and I was fine. The second dose of the vaccine that I got 21 days later, um, I got it in the evening, and the next day, got up. I felt a little bit sluggish. I still went around, did my thing, and then I realized I had a fever. So the rest of that day, I think I got it a Thursday night. The Friday, I laid low. I pretty much slept the day away, and by Saturday, I was up and about doing my thing. So I had a low grade fever, and I was feeling tired. But again, for me, that only lasted one day. All right. And then I see a question from Tasha Edwards. So what happened if you get the first vaccine and not the second?
Exactly.
Yeah, we answered that a little bit earlier. I think Tasha, I think you jumped in a little bit late, but we will address it again. You said the first dose is not as if getting just one dose is not as effective as getting two, but one is better than none. So you still
None.
do have some protection. So you still do have some protection if you just get one dose. If you have the opportunity to get the second dose, I do recommend that you do. But if for some reason that something outside your control that you can't get the second, getting one would give you some protection. It is better than not getting it at all.
And she asks a second question: when are they going to have vaccines for uh, folks under the age of 16?
They're currently working on it.
They're in
It should
studies
be,
now,
yeah.
so it's be pretty soon,
Yeah, it
literally
should be
within a few
soon.
months.
Yeah, it should be before we get into the summer.
Yeah.
They're working on ages 12 to 18 right now. So they're doing studies to look into that. So it should be within the next few months. Let me just scroll through and make sure I haven't missed anyone's questions. If you still have questions, please do post them live in the comments. So if you have any follow-up questions and questions that you've asked before, or if there's any questions you asked about anything that we've said.
So she has a third question: do you think vaccines will be required for flights, concerts, etc.?
No, this is what I'll say. Everyone has to weigh their risk and their benefits. So flights and concerts depends on what's your job are considered non-essential. So it's like I wouldn't and this is personal. This is Kwame's recommendation. This is not CDC or anything like that. If it was up to me, I wouldn't require it. But again, flights and concerts, you don't need flights and concerts to actually live, right? So it's like if it's not an essential thing for me personally, I'm not going, even though I've been vaccinated, I'm not going to a concert with a crowd of people anytime soon,
Yeah.
right? I'm just not taking that risk,
Yeah.
so
But as
I
we know,
do.
we can't put anything past people. So, historically, when the during the 1918 influenza pandemic, they had passports for vaccines. So if you had to have proof of vaccination on your person in order to get in and out of certain places. So I mean, if you can't rule out the possibility.
Yeah,
This is all you really can't.
yeah, and they're actually working on that now. I think certain places are requiring it, the vaccine
Mm.
passport. I'll just say for me as a
Yeah.
personal opinion is like, you know, how I handle things. If it's non-essential and I can avoid it for now, and I would say,
Right.
I work with people in the music industry. On the flip side, I know with concerts and stuff shut down, that is a lot of people's livelihood. And I
Yeah.
know artists and musicians they're really struggling. It's like the bills never stop coming, but they have no source of income. So that is really difficult. So I'm
Yeah.
very sensitive to that as well.
I have another question by Miss Creighton. Do you think the vaccine will cover the second strain they're mentioning? Um,
Yeah.
the strain, I guess I assume is the Kent or UK strain. I think is what is most likely she's talking
Mostly,
about.
probably because that's the predominant strain in the
Yeah.
US now.
Yeah. Yeah. That's a good question. So what? The Pfizer folks and the Moderna folks and the AstraZeneca folks claim that it covers that strain. Um, what you've heard anything else?
Yeah, it does, but it's less effective. So like with Pfizer and Moderna, which are like 94 and 95% effective respectively, with the variants, the protection is a lot less.
Yeah,
It's a lot less than the 94, 95. So there is some protection, but you don't have the protection as you have against the original Wuhan strain. But there is some
yeah,
protection.
yeah,
And with that said, it's an unknown whether or not it's an unknown about how many strains there are, because it's, what we know about viruses, that virus, they mutate all the time. So there's,
Uh,
there's the South African strain, there's a UK strain. I mean, there's probably more
the
strains that
Brazilian.
are
Mm,
unnamed. That's just what viruses do. They mutate.
right.
And will we require a booster? The answer is most likely
Most
yes.
likely.
Yeah, at some point
Most
we'll
likely.
probably require a booster. And if you think about like a tetanus shot right now, how soon will you need the booster? Not sure that, you might need a tetanus booster every 10 years. This will definitely be, if we need a booster, it'll be well before 10 years, might be a year,
Yeah.
a year or so, if we need a booster. And that's just my educated guess based on what I've read and what I've seen so far. So there's a good chance that we will
Okay.
need a booster. I don't know if I
Yeah.
answered the question as to how long the protection of the current vaccines last. And again, because they haven't been around that long, no one is
Mm,
really sure. I know they've done some studies where they kind of measure the antibodies in your system. They measure the antibodies in your system to see how long they last, and the antibodies are lasting, several months. I know the longest study I think they have is 6 months. It's not that the antibodies last 6 months. It's like the studies are only 6 months long. So when
right.
they measure them at 6 months, they still see antibodies. Now, additionally, in those studies, they have memory cells are developed, and we know memory cells confer immunity much longer. And so the theory is it could be a couple of years based on
Yeah.
what we know about. And again, that's hypothetical based on what we know about memory cells.
And then the other question is, will you have the same side effects with the booster, if it's suggested? So, she got very sick from the second vaccine dose. I suspect you'll have side effects, particularly with memory cells, floating around. You're gonna have, yeah, definitely.
And what I tell
Um,
people to do is that if you don't know what will happen, like, because I was down for a day after my
yeah,
vaccine, I generally recommend to people that the day after, just plan a clear your schedule.
right,
If you don't work on the weekends, if you can plan your second shot on a Friday, or if you don't have that much control over your schedule of when you get the vaccine, the next day
right.
just plan to have a light schedule to give your
I
body some
like.
time, some
I
time
know
to rest.
a lot of large employers. They are not only they're having people not take the vaccine all at once, like where I worked, so that nobody could come in the next day, but they actually make sure you have that day off the next day
Yeah.
because you can. I mean, that's just it's such a pro-inflammatory virus and vaccine that you just can't get around those sometimes. Um, you know. Samantha Coates has a question. It's a good one. Is it okay for pregnant women to take the vaccine? So, I had a patient who was pregnant and wanted to take the vaccine, and yes, it is okay for them to take the vaccine,
Yeah.
regardless
Definitely.
of yeah,
What was
regardless
the
how far
question?
along they are in gestation. So,
Yeah, it's okay. So, do you think it is true about certain blood types more resistance to getting COVID?
COVID. You
Um,
did any research on that, Kwame?
no, from what I know, I don't necessarily know if it's a blood type. I know certain people just, it's like in the community, certain people don't typically tend to get sick. I don't think it's a
Right,
blood type thing. You're like, just like
right,
Darryl mentioned earlier, some people get mild COVID. They get
right,
the infection and their symptoms are like really mild, and it's probably a combination of several things, and the blood type is probably not the only thing if it contributes at all. So
right,
I haven't really seen any data that says
right.
a certain blood type, and I'll have to do a little bit more research. If I find anything, I'll post it
Yeah.
on the JEC page afterwards. But I haven't seen
Hmm.
any data that says one blood type over the other
Versus the
is
other.
is more
I know that
protected.
last year, March, there was preliminary data showing that O negative folks may not, just because they don't have as much antigens in general,
Antigen.
yeah, may not get the severe form as much. But I don't think that's panned out. It looks like the blood type issue is not He's not going to be a big player.
Yeah. Yeah. So I'll definitely look into that further. And like I say, if I find anything, I'll
Mm,
post it in the JC group
okay.
on Facebook. Any more questions or comments? Can at the hour mark. Is there any other questions or comments that individuals have? If not, I'll give Darryl some final remarks, and then I'll have some final words as well. So Darryl.
Final remarks. As we mentioned in the beginning, eventually the decision on getting the vaccine or not is going to be up to you. But just bear in mind that it's fighting off this virus, which almost conceptually you have to think of it as it's trying to literally destroy humanity. Just put that in perspective when you think about things, because it's we're all in this fight eventually. You know, it really is on a global level. So, what are your thoughts, Kwame?
Yeah, I'll say in summary, to not as eloquent as Darryl, I'll say COVID sucks.
It's pretty bad. Like, COVID is so bad that even when a family member dies, it has to be a closed casket, because the dead body can still be infectious. That's how horrible this disease is. You cannot even see your family member at the funeral.
Yeah. So
Yeah.
COVID sucks, and we pray that we get out of this. Definitely our hearts and prayers are with you know with everyone who suffered the loss of loved ones. I know several people have actually suffered multiple deaths. In within one family.
Yeah.
Um, and added to insult to injury, so to speak, is not being able to go to the funerals, or even usually have the support of family and loved ones. You can't hug, you can't embrace, you can't comfort one another.
Yeah. Yeah.
um Irene has one question. I received my last vaccine on the 6th of this month, plan to travel on a train Thursday. Is it safe? I would say it is safe for you to travel. I would continue to follow guidelines in terms of wearing your mask, hand washing, and stuff like that. I still wouldn't drop your guards, because you don't know who around you have been vaccinated, or where they've been or what they're doing. And especially traveling on a train, I don't know what the ventilation on train is like, and how much fresh air is
Right.
moving through the cabins and things like that. So those are things to consider. I was looking at a simulation of how the air circulates through airplanes. I know they really
Mhm.
done some work with the ventilation on airplanes. I'm not sure with trains. I would say if you plan to travel, if you're safe and you're vaccinated, I would say go for it. Um,
Yeah.
but I'm saying in closing, I would say a lot of people have suffered tremendous loss, and we don't want to downplay the deaths and the sickness, and even people who haven't died, but they have long COVID symptoms. Some people are recovered and not fully themselves even after months of getting COVID. The economic impact of it, I've had people who've closed their restaurants and bars and stuff like that. Like literally, that's their livelihood that just gone. So
Yeah.
I'll say we're in this together. Support one another, call and check in family and friends. If you're in an industry that hasn't been as severely impacted by COVID as other industries, support one another. I would say it's okay to pay someone's rent for a month, or pay their a bill. I mean, it's not too much. Let us truly be a village. Let us be a community. Let's look
Yeah.
out for the elderly in our community, and be a support to them, because we're really in this together. And so really thank, JC, and, the president, Al Martin, and the vice president, Lorenzo, and Lorraine, our PR and secretary, and Kemoy is our technical engineer or IT person behind the scenes, who this is actually his brainchild. So Kemoy, thank you for bringing us together and
Definitely.
putting this together. It was really good. And hopefully in the future, there are other topics that we can talk about. Hopefully this isn't the last time that we'll get together. So thank you everyone so much, and it's really our privilege to be of service to our community. Thank you.
Yeah, thank you.